Gestational diabetes is not just a diagnostic problem, it can be a very severe clinical problem. What happens during a pregnancy is that the blood glucose which is elevated for the mother finds free passage across the placenta to the baby. So if the blood glucose values are high in the mother, so the baby is exposed to high glucose values. But unfortunately, the baby is having normal amount of insulin and has normal glucose tolerance, unlike the mother. Being a growing fetus and being very young, it has got everything normal. So because of this, there is a high level of insulin production in the fetus, and the baby incorporates all the extra nutrients that cross the placenta and go to the mother. So the baby can put on weight. So this shows up as an increased abdominal circumference for the baby, and also it causes relative hypoxia in the baby because of the high blood glucose values and high insulin levels. There is a shift to the left in the oxygen release curve in the baby, and because of which there can be polyhydramnios or excess water accumulation in the amniotic fluid, and this can be a very dangerous thing. And in extreme situations, when the amniotic fluid index becomes very high, then the baby reduces its fetal movement, it will develop distress, and cases of intrauterine death are also seen in patients who have uncontrolled gestational diabetes. But apart from gestational diabetes, other aspects also can be an added risk factor to the fetus. So in addition to gestational diabetes, there can be gestational hypertension, there can be the age of the mother. When all of these things together are adverse, the risk to the fetus is more than just alone gestational diabetes. So when you have multiple risk factors or problems, say you have gestational diabetes, you have hypertension, you are also elderly, age more than 35, then the risk to your fetus is going to be much higher than usual, and you need to be very careful. We need to control the blood glucose, control the blood pressure, as well as make sure that a fetal movement count is maintained. So these are some of the risks that can happen to the fetus, and this is how to take care of the fetus while you are having gestational diabetes.